Hey world, Ruth Telsek, author, and I'm back. I am here today with episode 9 of my YouTube program, Help Me Please. I'm Ruth Telsek, your host, author of I Am Not the Girl, finally got it right, Memoirs of a Certified Nursing Assistant. And today's program is going to be centered around Medicare, Medicaid, your mama care, and you. So, I said, I wanted to base today's program on something that I got in the mail last week from my insurance carrier. Medicare Part D explanation of benefits. I'm like, wait a minute, just when you thought you had Part A, B, and C, now is D. It's almost like I gotta go back to school to keep up with my healthcare program. All these letters and symbols and whatnot. And when we out there, seniors, we don't like a whole lot of confusion. I don't. I like clean, simple, easy. That's what I like. Just give it to me like a child. Just to make it as easy as possible. Not saying I couldn't comprehend any further, but some of us are, we mellow out there in our years and whatnot. And you just need to take your time and talk to us and let us know in plain, simple English what's going on with what we're facing, our new reality, getting older. Because we're not getting any younger. Getting older. Let's call it what it is. Okay, so I sat back and I did a little Googling, a little bit of research out there, and I said, okay, what is Medicare? Well, Medicare is a government national health insurance program in the United States of America. Okay, it began in 1965 by President Lyndon B. Johnson. He was the president then. He signed it into law for Medicare and Medicare programs to be available to people in the United States. Okay. It was underneath the Social Security Administration and is now administered by the Centers for Medicare and Medicaid Services. Okay, so you're like, well, what's that? Okay, Medicare is a payroll tax that applies to all earned income in the United States and supports your health coverage when you become eligible for Medicare. Medicare taxes are used to help people with future Medicare costs once they become a beneficiary. Medicare, a beneficiary to be on the program. Things vary, but we're going to get to that in a second. Medicare is a federal health insurance for anybody age 65 and older. Age 65 and older. Okay, and some people under the age of 65 with certain disabilities and or conditions. Okay. Medicaid is a joint federal and state. Medicare and Medicaid is a joint federal and state program that provides health coverage with some. Let's get this right. Medicaid is a joint federal and state program. Let's get that right. Medicaid, not to be confused with Medicare. It provides health coverage for some people with limited income and resources. Like, we ain't looking down our nose at nobody out here, because some of us, things happen in life. Let's put it that way. You could be up here today. You could be down here tomorrow. You hear this now. Something happened later. Life happens. It happens, okay? So we're not putting nobody out there like that. Or you could have the Medicare, and then you may have be reduced to in your situations where you may need Medicaid. Okay, but why do I need this? Medicare covers your costs for health care, like doctor visits and services. Most people don't pay a premium for Part A. Okay, let's go back to the beginning. Part A, Part B, Part C, and now Part D. Whew, sure. Okay, let's get back to Part A. All right. You don't need a premium for Part A, all right? But you do pay a monthly premium for Part B. If you can't afford the monthly premiums, there are programs available to help you with your costs. Okay? Part B. Okay, Part A. What is Part A, Ruth? Hospital insurance. Like if you get admitted to the hospital, Part A will pay for XYZ amount of days while you're in the hospital. Part B is your actual medical insurance. So Part A is in conjunction with Part B. Part C is private insurance, like you have your carriers, Aetna, Blue Cross. These are Medicare approved companies, supplemental insurance, to go along with your Part A and your Part B. So you got A, B, and C. Or sometimes you may not have enough money to pay for private Part C insurance. That way, some people, they have Medicaid in conjunction with their Medicare insurance, because sometimes people have limited incomes, things happen, and you still need coverage. Okay. When can I sign up? You can sign up when you're 65, or something should happen, 62, depending on your circumstances. There are risks and penalties, and sometimes you can have gaps in your coverage. So we'll get to that in a second. Okay, there are open enrollment periods. Open enrollments is the time that's available for you to go and sign up for your Medicare programs or your insurance carriers in conjunction with what you're going to get through Medicare. All right. And sometimes they have special open enrollment periods. Okay. What happens to your coverage? And I thought this is kind of strange, because this just came across the website. I was like, really? What happens to your coverage when you become incarcerated? You be like, I ain't going to jail. Things happen. Don't never say what you're not going to do out here in this world. Things, just to say, I'm just put it out there. Things happen. All right. I'm in jail. Probably on a self-defense bed, but who knows? It covers nothing while you're incarcerated. I'm sure at some point the state probably makes there is health coverage in prison. We're not going to talk about that because that's not the topic of the day. But once you are free from your incarceration, and I guess if you're of a certain age or whatever, you're still going to have to keep paying for your Part A, your Part B, or just get on the county roads. You know, like I'm saying, it's life out here. It's hard out here in these streets, y'all. Whoo, child. Getting old is not easy. You have to prepare. Staying young ain't easy either. Because y'all, it's a feat to be young to get old. I tell you. So I sat back and I said, well, you know, what did our parents used to do before? What did our parents used to do? Excuse me. Oh, Jesus Christ, folks. How about turning off the phone? God. Oh, sorry about that. What did our parents used to do before Medicare and Medicaid? Well, as long as I can remember, some people had doctors come to the house. They had medical clinics in the neighborhood. But there was always this long-running joke out here about Robitussin. Being able to use Robitussin for everything. Please. All I remember when we were children, we got the chicken pox. My grandmother would go to a pharmacy in the neighborhood, come back with a bag of leaves, boil it. Here, drink this. She had a strap. She had some carbonated Vaseline. Here, drink this. Don't scratch. Because they had a certain thing. They didn't want to see their kids with marks and cuts and stuff all on their skin. It was a child place. I remember the days of taking Rem, Father John's, castor oil. Now, don't get me wrong. If I'm feeling really, really bad, I don't have no problem taking that castor oil. No deductible. And you weren't lingering and languishing, being sick forever and a day. Look, it got in you, it came out of you. Next day or two, back to whatever. But those little orange aspirins that our parents used to have to hide from us because we thought they were candy. They did taste good though. Things were just different back then. People ate differently. we weren't so subjected to a lot of things, but as time went on, things changed. Technology changed. Rules and regulations changed. So I guess when you don't really sit back and think about it, wow, you were pretty much at your own will when you got sick back then. It's like it almost kind of sort of blows my mind now when I think about it. You only went to the emergency room when it was emergent. That was like a last resort. But thank God for modern technology, because it's out here saving a lot of people. It's really making changes in our everyday lives out here. And I applaud the doctors and the scientists who are making this happen. Yes. So, I said, this topic is really long. This is like a lot of information on this just one topic. So I said, well, here's the information that you need to educate yourself about how to get on Medicare. How long do I have to keep working before I'm eligible for Medicare? Do I want to opt out early? Do I want to leave the country and get on Medicare? A lot of things you need to know. So you can go to www.socialsecurityadministration.gov, medicare.gov, or you can call 1-800-633-4227. Wow. Information, or the National Institutes of Health.com, and you can find out the history of medicine and the things we used to do before the Medicare Act was signed into law. Well, folks, I'm not going to bore y'all to death today, because today for me is really, really special. It's my birthday. Happy birthday to me. Yay. It's going to be a long day. I am Ruth Tosick, author. I Am Not the Girl, Memoirs of a Certified Nursing Assistant, and I will look forward to you guys to being with me next month in another episode of Help Me Please on my YouTube channel. It's going to be a little bit surprising. I'm going to add a little something extra in Espanol. Bye-bye. Take care.